It's really important to have a trusting relationship with your provider. You want to be able to build a relationship in which you can freely and comfortably talk about how you're feeling, changes to your environment, and really feel comfortable expressing any concerns you have about your treatment so that together you guys can make some deliberate and dedicated decisions related to your treatment plan. The best way to ensure successful treatment outcomes is really to have a full team. The team would include a psychiatrist and probably a therapist, but it also could include a case manager. It really would depend on the needs of the person, and tailoring a treatment plan that is culturally sensitive and tailored to the needs of this individual is going to be really important. Antipsychotic medications decrease the level of dopamine in the brain, which really impacts the positive symptoms. So it really will focus and target the hallucinations, the delusions. They are unfortunately not so effective on the negative symptoms, so that lack of motivation, that lack of energy. Second generation antipsychotic medications are newer. The older medications would tend to produce a lot of involuntary movements that sometimes don't go away if they're on treatment for long enough. Tardive dyskinesia is one of the long-term side effects that we tend to see with the first generation antipsychotics, where you have these involuntary movements that just won't stop. So with any medication, we talk about the risk versus the benefits. And would the risk of developing tardive dyskinesia outweigh the risk of not having your symptoms treated? With respect to people who are struggling with schizophrenia, cognitive behavioral therapy can be helpful. There are other therapies that we use to really just kind of accepting you're having these thoughts, you're having these feelings, they're there, we validate it, and how do we live with it? And that can be a lot more helpful often with people who struggle because of the lack of insight and because of the lack of awareness. So the benefits of sticking to a treatment plan is really consistency and stability. It prevents you from having worsening of symptoms, and worsening of symptoms tend to lead to disruptions. So disruptions in your personal life, your work life, or your school life. Also, every time we have a relapse or worsening of symptoms where our brain is exposed to psychosis, it does a little bit of damage each time. So really trying to have consistency with treatment and stability is important from that standpoint. And it just allows you to be able to carry on your functioning of day-to-day life in a manner that is predictable, which gives us much more confidence really to kind of go out into the world and live and be our best selves.